Hello and welcome to our channel where we go through all things related to pregnancy, birth, parenting, and beyond. This week we are doing a Q&A episode where we take questions from you and answer with like the evidence-based and experience-based information.
Yep, and just in case this is your first time meeting us, I'm Kurt, I'm a board-certified pediatrician.
I'm Sarah, I'm a board-certified OBGYN, and we are the Doctors Bjorkman.
Welcome back. So starting off today, first question from Pradeep Cox 9465. Your thoughts on screen time across different ages? Playing in the background, example football game versus intentional screen time, example educational content.
Sure. This is somewhat nuanced, and there certainly is some data behind recommendations and effects of screen time and things like that. So I think that warrants a full episode with kind of more details. But here are some things we think about and try to balance.
Yeah, and so first, just starting off, the American Academy of Pediatrics actually has some guidelines on this. Starting out, just allowing some screen time younger than 2, especially if it's for a group involvement, especially like FaceTime, etc., where you're allowing your children to communicate with family members, caregivers, etc.
Because they used to say no screen time at all before age 2.
Yeah. Having said that, like anything else is really not beneficial, especially under 18 months. The AAP says avoiding screen time other than video chatting at all for those less than a year and a half of age. Between that 18 and 24 months range, to say, hey, maybe if you find high quality programming, if you're choosing screen time, and make sure you're watching playing together at that age. By the time they're 2, then maybe they're able to start to watch independently a little bit. Again, there's pretty limited benefit of the screen time at these ages, but between 2 and 5, limiting the screen use less than 1 hour per day, and ideally using high quality programs.
Yeah. So I think the big takeaway for littles there is, 2 to 5, no more than 1 hour a day, and co-viewing, or like really engaging with your kids when you're watching a show. Talking about what's happening is kind of the recommendation from the AAP. Sometimes that is not a precisely relaxing time. So like we tried to watch The Wizard of Oz this weekend, and we're in that ask a question about everything phase. I don't know why the yellow brick road is yellow. I don't know where the Munchkins live. It's a special time sometimes.
Yeah, and definitely there's a lot of times where there's the temptation to let screens be the childcare. Like I know, like for instance, Sarah's running late from work, and I get home first, and I'm making dinner, and the 2 kids are running around, and I just need them to let me cook. And so it's like, hey, like we're gonna watch a show quick. And so I definitely understand that is part of human life for so many of us. Limit that as much as possible, because there's definitely data that shows there is such a thing as too much screen time, and that it can have negative effects on the development of your child. This could be things like sleep problems, things like obesity from just being not active enough. Behavioral issues come up, eye strain, mental health issues, all of these different things. And there's kind of different flavors of this that we'll try to do an episode on, of like certain things inhibit language development, certain things are more likely to cause anxiety, depression, like video games, etc. And so kind of being careful about that. Definitely being thoughtful about finding programming that's a little less stimulating. And interactive as the best as you can. And the best thing is to be interactive with your child, with the screen, if you're choosing to use that, etc.
Totally. And I think we notice when the kids get too much screen time or more screen time as usual, they don't regulate emotions as well. They definitely do a lot less like creative free play. And so it is something that is hard. It's really hard. And I think like the football question, some of that's like a family culture thing. And Sundays are a day that we watch football and have snacks. And so balancing that engaging versus the kids, the TV's like the babysitter, I think are things to work hard at. Parenting is hard. Like totally get it.
Also just like we really work to avoid just the TV or noise being on in the background, aside from like gentle music, like just having that extra sound. Actually, there's some data that may also inhibit language development. Remember, in your young children, your toddlers, their biggest goal is just to learn how to speak, how to interact, learn how to imagine, etc.
Yes.
Well, some shows we love, just if anyone's looking for examples.
Yes.
We've been big Dino fans in our house lately with our now almost 2-year-old, almost 4-year-old.
Yes.
Dino Ranch is fun.
It's a Disney.
Dino Train is a Canadian broadcast channel show that was
I
on
think it's on
Prime
Amazon
now.
Prime right now.
That like they love kind of low stim things that are like, if like Cecilia wakes up super early and like I got to get ready for work and shower, like Little Bear is nice. Has like great classical music, slow plots.
Yep. Stella and Sam, if you give a mouse a cookie.
That's about it.
Are some good ones, and they're low stim.
Okay.
Yes.
Hopefully that helps.
Yes. All right, our next question comes from Forever Fictional 12. And the question was, thinking about the kind of parents you thought you would be before you had kids, how have your expectations compared to your experience? Has parenting come naturally to you? Were some things a lot harder than you expected?
Yeah.
I would say that I have joked, even recently, that I was the best parent I ever was before we had these kids. Because once they arrive, some of these ideas you have about parenting kind of go out the window. Because those kids, they don't read the books on sleep or tantrums or whatever. So anyway.
Yeah, and definitely even like from one kid to the next, you like think about the things you learn and master with the first child, then are no longer as helpful for the second child.
They're just different.
Clearly I am a pediatrician. I love kids. I think some of that has come naturally in terms of like being engaging and having fun and playing. Like my goofiness works out well. Like even just like having a partner who balances each other out is really nice sometimes.
Yeah.
Like you can be a little bit more patient than I am sometimes, or like things like that. And knowing your own strengths and weaknesses and just how it changes even from season to season with kids.
Yeah.
And balancing off your partner has been good for us.
I think adding our second kid was a butt kicker. And that was surprising. Like adding one was fun. It was an adventure. We did everything together, and like I felt like you could really give each other a break. And it's a babysitter can handle one kid, and then you add two, and it's a lot of everybody one-on-oneing. And I felt kind of lonely sometimes in the early days. But some of it gets a lot easier, and I'm hoping with adding number 3, your expectations or like understanding what is normal, reasonable behavior for a toddler or a little kid just totally changes. Like it isn't something you necessarily see a lot unless you have kids with little people. And that is something I think we miss in not having a village, is like understanding what are reasonable expectations for your 18-month-old. Like, hey, Bowie's not going to sit through a long dinner out. We're going to get there. We're going to get fries the moment we sit down. The second the food hits us.
We just bring our own snacks and our own bottle of ranch.
Right. You just like learn what they're capable of, and it's just like your expectations of what
and setting yourself up for success. Like have things with you and like have an exit plan.
Yes.
All of those things. So like I think some things have been easier. A lot of things have been harder.
And a lot of things you like just learn and get better at because you've never done this before. And even once you figure it out for the first one, it all just changes with the second. So you just get better.
The hard is always there. It's always changing.
It's always hard.
But like the joy and the awesome like gets better and I think grows.
Yes.
They can tell you they love you and give you a kiss and like all of those things that just like are pretty special.
Really.
Okay, next question. This comes from Christina Henze, 151. They say, would love your thoughts on the recommendations of taking baby aspirin for people with high preeclampsia risk. An example, preeclampsia in previous pregnancy. I saw some sources recommending it, others don't.
Sure. So the American College of Obstetrician and Gynecologists, so ACOG, as well as the Society for Maternal Fetal Medicine. So these are kind of the big 2 colleges in the United States who make recommendations and give us our guidelines on pregnancy care. So both of these organizations support the USPSTF's guideline criteria for preventing preeclampsia. And so they recommend low-dose aspirin, or 81 milligrams a day, as prophylaxis, so prevention, for women who are at high risk of preeclampsia. They recommend you start this between 12 and 28 weeks, but optimally before 16 weeks, and you continue that every day until delivery. So this low-dose aspirin prevention should be considered for women who have more than one of several moderate risk factors or just have one high risk factors. So the high risk factors are a history of preeclampsia. So right there, history of preeclampsia, you rule in. Both of these organizations recommend you start taking baby aspirin between 12 and 16 weeks. If you have multiple gestations, so twins, triplets, higher, start taking that baby aspirin. Autoimmune disease, type 1 or 2 diabetes, as well as chronic hypertension. Each single one of those things, they say, meets criteria to consider this prophylaxis. If you have more than one of the following moderate risk factors, you should also consider this. So if it is your first pregnancy, if you are above 35, if your body mass index is above 30, if you have a family history of preeclampsia, or you have some other socioeconomic characteristics or personal history. Again, these are things to go through and review with your OBGYN. But if you have multiple of those things, it is a great idea to think about starting that baby aspirin. Always talk through your history with your OB.
So as little as 2 of those moderate risk factors. So if it's first pregnancy and BMI greater than 30, something to consider with your OBGYN.
Correct. Sometimes an IVF pregnancy is also considered. That's something we certainly do as also a risk factor. So if it's your first baby and you're 35 or older, there's something to consider. If it's your first baby and it's an IVF pregnancy. So there are many, many people who rule in to consider taking this as prophylaxis. It's been shown to help decrease the risk of preeclampsia in that pregnancy.
Okay, great.
Next question comes from Katie Benda 5237, and she said, I'd love to hear Kurt's thoughts or info about SVT in infants. We ended up in the hospital with our 2-week-old with SVT. It's actually pretty common, but I knew nothing about it.
Yeah, so first question is, what is SVT? This is one of our cardiac acronyms, supraventricular tachycardia. And before I dive into that, I think it's really important to know that, it's amazing the number of things that can surprise you in parenting, especially when it comes to potential medical diagnoses, where everything is kind of relatively rare, maybe for just you, but it's amazing that the chances and the likelihood of ending up in the hospital is definitely not zero. Right. And so I think that's one of the things about the parenting journey is there are surprises that are going to come, and we're definitely our heart goes out to you that you ended up in the hospital with a
scary thing,
with a heart arrhythmia.
Yeah.
Now this one in particular is really fast, high heart rates that are pretty common. It's one of the most commonly drilled kind of codes examples for pediatrics because it's so common, especially in early infants. There's some new data about, hey, do you have to treat all of them once you get this arrhythmia to go away acutely? Do you have to treat them long term or not? Or how long do you treat them? All of those things are advice you're going to be getting from your pediatric cardiologist that hopefully you're plugged in with already. Sometimes even a rhythm specialist if it's something that's recurrent, coming back, or needs more than just one medication to control. It's something that we see and take care of often. Almost every week I'm covering the hospital. I have a new baby with SVT because it is common in infants for certain reasons. It can definitely show up later for other conditions. Wolf Parkinson White, there was a Modern Family episode about. Claire had SVT too, but it's a little bit different form in infants than it is in older people. So hopefully and fortunately for most babies, it's something that can go away as they get out of the first kind of early infancy period, and so hopefully that's going to be the case for you guys. Either way, best of luck, and hopefully things go well for you.
Yes, find a great pediatric cardiologist.
Yeah.
Next question is...
This comes from Brianna Marin, 6062. They say there's so much information on gestational diabetes, but I would love to learn more about how clinicians approach pregnant people with type 1 or type 2 diabetes. Do they still take the glucose test? Yeah. Most of the information I see indicates that all pregnant people take the glucose test, but if I understand the gestational diabetes diagnosis, it's only given to people who are not previously diagnosed.
So we have a whole episode that we will link here all about gestational diabetes, and you can check that out if you want more detail. But briefly, if you are a known type 1 or type 2 diabetic, then you don't have to repeat that glucola test. We know, right? Yeah. Gestational diabetes is just diabetes during gestation, during your pregnancy. So with pre-existing diabetes. We know this ahead of time. We know that it's harder to manage this during pregnancy. One, because the placenta starts making hormones that make it more difficult and make you more insulin resistant. And a lot of those pre-pregnancy medications we use are not used for pregnant women because of safety concerns. So those two things, you can't always use your pre-diabetes or your pre-pregnancy meds as well as pregnancy itself makes you more insulin resistant, make it a little trickier to manage pre-existing diabetes. ACOG recommends insulin for all women who need medication. And so that is the big difference is...
Yeah. And either way, I think it's really important from the pediatric side of things to make sure your diabetes is under good control, whether you had that diagnosis beforehand or whether you get that during that second trimester of pregnancy.
Yep.
There are increased rates of birth defects in women who are pregnant with babies who have diabetes beforehand, and then also people who have uncontrolled diabetes later in pregnancy are more likely to have large for gestational age infants,
Yep.
And other things that can just be bulked up. Sometimes we see hypertrophy of the heart muscle itself too, and so lots of things that just say, hey, if you have a diabetes diagnosis, make sure you're plugged in with your provider to make sure you're getting great care and control of your diabetes and blood glucose numbers as able.
Right, we care about those for your heart, your blood vessels, all of these things for mom's overall well-being, but also for baby while you are pregnant. And so it's really important to manage those. A lot of times practices will have like a diabetes educator who helps, or they send you to the high-risk doctor to make sure that you're managing those blood sugars as well as you can. So.
Great. This next question comes from April's Diary. They say, how did you manage the transition from 1 to 2 kids? What did you do as a parent, not a doctor, think is the best age gap between kids?
Cease and Bo are 22 months apart. I thought that transition was rough. 2 under 2 is rough. 2-year-olds
Some people love it.
Their own little beast. Some people love there's it. There's so many wonderful things. I thought it was a struggle bus, but now in terms of like, what do you think is the best age gap? Seeing Cease at 3.5, about to have a new little brother, and just the 3-year-olds are their level of understanding, ability to reason.
The challenges are different. The hard changes, right?
Yeah. The hard changes, but I feel like 3 years seems like a more civilized age gap than 2 years.
So if you could have picked, you would have done 3-year age gap?
I think so.
Okay.
Yeah?
And this is from people that did 22 months, and now we're going to be 4 months apart between our kids, so we're doing the 2-year gap.
Again.
There's definitely people that pack in more kids in frequent intervals. We did an episode all about ideal pregnancy spacing and health risks for that too.
Yes.
Some of it though, like when you're in the baby phase, just being in the baby phase is fine.
Yep. And I think it's so kid dependent.
Like we just happen to have a spirited firstborn.
Correct.
That really is pushing us to grow as individuals all the time.
Indeed. So I think when they look back in like evolutionary things, child spacing, most of the time it was more like 3 to 4 year age gaps is kind of how it ended up naturally being spaced. Just because of, if you think about
lactational amenorrhea, like you're not
nutritional things where babies like really attached to you. 2 under 2 would have been terrible for the cave people. Like, how do you keep 2 little babies alive? So I think 3 years maybe is the sweet spot. We're going to do this.
We've done 2 years and we're having fun. It's work, but we love it.
It is, and we're hoping the little boys are going to be little buddies because they're 2 years apart. So here we go.
Okay, the next question comes from Music Lover Mama. They say, tough topic, but what I want to know is what sort of testing next step should be done after multiple consecutive pregnancy losses? God forbid I should have another loss after 2 last year, but my doc won't order tests unless I lose another one. Just want to know what I should expect if the worst should happen. Thanks for all you do.
Oh, I am so sorry that you find yourself in this situation. Loss is so hard, no matter when it happens. Like, early, late, it's also brutal because with that positive pregnancy test, I always tell patients you kind of plan a whole life. And so it's really tough. The recommendation from ASRM, the American Society for Reproductive Medicine, is actually that you should undergo a workup after 2 losses.
Does it matter if they're in a row consecutive or not?
This is getting into some of the gray area of reproductive medicine of how far along do you have to be to count this as a loss? What 1 in a row versus 2? It's a conversation to have with your doctor, but most of us who in the reproductive medicine space, infertility, recurrent pregnancy loss, kind of say, hey, this is all on a spectrum, biochemical, clinical, etc. And after 2 losses, think it's very reasonable to initiate a workup. So if that isn't something your current OB wants to do, it is absolutely worth finding another to say, hey, let's talk through it. Let's talk about what the evidence says and what the workup is after 2 losses, which is kind of thinking about genetics, anatomy, lifestyle factors that could be going on. There's a whole algorithm of things that's recommended that after 2 losses, it's defined as recurrent pregnancy loss. So find a physician who feels like a good fit to do that with you.
Absolutely. 2 losses is really tough. Any loss is tough. And, you like get so much hope, and then to have that stolen is challenging.
And none of us want to say, hey, wait for the 3rd one, and then we'll do all this. So,
okay.
Next question.
This comes from Emmy Arias, 2454. They say, is it okay to color my hair on my 3rd trimester?
And the answer here is yes, absolutely. Color your hair, paint your nails, all of these things are great. If you want to be, super cautious, avoiding bleach, things like that, using plant-based stuff. But unless you have some kind of like open scalp wound and we're worried about the integrity of your skin, it is totally fine to get your hair did. Look good, feel good. So enjoy.
Avoid heavy metals.
Yes.
Okay.
The next question comes from Jaden Delancey, 2435. Tips on potty training. About to start with my 19-month-old daughter.
Okay, good luck.
You've got it. You can do it. It's going to be great.
We did a couple episodes on this past fall, all
Yes.
about like when's the right time. 19 months is actually right about when we started our son.
With Bobby.
It works great. It's definitely, there's different challenges. The earlier you start, kind of the longer you're going to have to do it because they don't have as much kind of developmental maturity to fall back on. And so it's a little bit more like you're potty training yourself when you start at a 1.5 or a year old.
Right.
Historically, most kids were potty trained by 1 year of age. And so like you're spot on, potty training older kids, toddlers comes with it different challenges. They've got a lot more ingrained behaviors. And so sometimes that's tougher, but you also have the benefit of them understanding a little bit more.
More reason, like can physically push their own pants down, things like more abilities than your little 18-month-old.
But check out our episode all about kind of our quick tips to getting started.
Yes.
And there was another one about the best time to start potty training your kiddo too.
Yes. Liz G 4690. What do your babies eat in a day? Minus the dog food.
So
Funny, Liz.
I don't know what it is about our son. He's just turned 2. He loves the dog food. I made Nutella crepes the other night, and he got down from the table and went and ate dog food.
I mean, we sound like delinquent parents here. We 99% of the time have the dog food thing
As tight as
possible. He can't get into it.
But he loves to feed them, and so he'll like scoop the dog's food and then intentionally spill some and like dive to pick it up and shove it in his mouth.
He just
I don't know what it is.
It's also hilarious and adorable. So
kind of thoughts on food. We like cook most of our meals at home at night. Things that we do that are quick and easy. Like I have a protein shake for breakfast every day, and so Cecilia loves those. She has one of those too.
Bowie has half of one usually.
Like we've done a lot of scrambled eggs over the years, a lot of oatmeal. They love broccoli for whatever reason with some butter and salt. So like those things.
Here's what they ate like yesterday. They had a protein shake and some full fat yogurt with granola and strawberries was breakfast. For lunch, I think they had.
Cease had toast with a tomato and.
Oh, that's sorry.
Some like a white egg that was fried.
She
and
likes
I think
egg whites.
Bo had some leftover noodles and sausage we'd had the night before.
Yep.
It's like nice about cooking extras. You always have like lunch the next day. our kids kind of eat like 4 meals, and all of them almost include ranch, but
Yes,
that's
they're
okay.
big into the dip.
And then dinner last night we had steak, like
potatoes, broccoli. Cease loves some baked beans.
yeah. You know, it's interesting. Cecilia loves so many, much wider variety of foods, and Bo is a lot more selective. I think a lot of it is kids. A lot of it is exposure. We keep trying to expose them to things.
Yes, they are offered what we eat.
They keep saying no to most of it. But
Yep, and then if that isn't something they want, they can have a peanut butter and jelly sandwich after dinner.
Cease is just jam. Yeah.
Cease is a just jelly gal, but we're trying for that to be the rule.
You know, and either like honestly, just keep offering them what you eat. We've heard like some people love serving family style. Maybe that takes some pressure off of like them having to eat what's on their plate.
Right.
You know, they love French fries when we go out, so that's usually like the first thing we order, just to like
Make
tide
it through
them
dinner.
over while like the food is coming. But
They get sweets, they get ice cream. It's not like a special thing. We kind of work really hard for them to listen to their bodies, and we talk about healthy food and getting a balance of proteins and veggies and fruits, and trying to build good attitudes towards food and bodies and things
sometimes
like that.
that's easier than others. I will say some just like an interesting data point, like the kids after about the age 4, they lose that ability to like, you know, their full mechanism, like, you know, when they're younger than 4 is a lot stronger in terms of like, no, I'm full, I'm done, I'm happy. And so sometimes, a lot of times with our kiddos, they like don't want to eat because they just had a big snack. And so thinking about that, but also using those first couple years of life to help them get a good relationship with food, and so we don't force them to finish their plates. Like when they're done, they're
Listen to
done.
your body.
Maybe we leave the plate out on the counter for 20 minutes. If they were like, we're just distracted, then need to come back. But you know, family meals definitely helps with that. So
But you do all the things. We baby-led, weaned, we ate all the foods, and then sometimes they want you to scrape everything off their pizza so they can dip the little crust into
in
some
ranch.
ranch. And
Yeah.
that's just what we ate today. And it's balance.
So some days are great. We feel like rock stars, and a lot of days we're like, they are really picky.
They're eating dog food, and that's it. So
okay. Anyway, thanks for the questions. We enjoy this. We're going to try to do this a little bit more regularly. We used to do this a lot more often, and so look forward to more monthly Q&As coming up throughout our other scheduled content.
Thanks for being here with us. Please subscribe to continue with content, as baby number 3 will be here soon.
Okay, bye
Have
guys.
a great day. Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.